This is certainly a hot topic, and it's one of the things that I'm asked about, maybe more than any other specific disease process. So, yeah. So, Doug, I'll let you
Okay.
rip away.
Well, yeah, I'm excited to be I feel like I'm participating, though I don't have any education in this field at all. But I do have a lot of questions. There seems to be a lot written about glutathione and cancer. So, what does the relationship have to say about this relation? The literature have to say about this relationship.
Well, first of all, I congratulate you for having the courage to bring on one of the most controversial areas about the application of glutathione in taking care of our health. As you can see from the slide here, this is an area that's drawn an incredible amount of interest. I mean, almost 30,000 articles about glutathione and cancer available to you. This is the reason I say that this is controversial, is that there are very distinct and differing opinions on how to approach this. And at the very least, let me say that the literature can be very confusing. So if you're looking at the literature and you get confused, you are not alone. So let me start off by saying this. It's quite clear and agreed upon that people with low glutathione levels are at significantly higher risk for the development of cancer. This has been shown by several methods, not just measuring glutathione levels, but more recently because of our ability to look at the human genome and determine DNA coding. These studies, which look at people who have abnormal glutathione genes, show them to be particularly susceptible to cancer. This is very revealing. Now, what makes this situation even worse is that cancer itself will further lower glutathione levels throughout the body. So study after study shows that the total body glutathione is lower in cancer patients than in the healthy population. So this makes the patient's defenses even weaker. And this is further demonstrated by the strong evidence that cancer patients with higher glutathione levels have far few negative side effects from their chemotherapy and radiotherapy. In other words, higher glutathione levels improves the tolerability of the treatment, which I'm sure you're all aware is often as unpleasant as the disease itself.
Okay, so I've seen a lot of studies that have demonstrated that glutathione levels in cancer cells are actually higher than normal. So the glutathione levels in the cancer cells themselves are higher than normal. Somehow that seems counterintuitive to what you just showed us there. Can you comment on that?
Yeah, that's hence the controversy. Good question. As we mentioned before, this glutathione in cancer is one of the more challenging areas. Here is the major reason for the confusion in the literature. When you measure glutathione levels in most solid tumors, you find that these cancer cells are actually high in glutathione. Interesting. And this can lead us to coming up with contradictory conclusions. Let me explain and pay attention now. You need to wrap your head around this. This does get a little bit confusing unless you're paying attention. So we have tumor cells, cancer cells that are high in glutathione. And because the cancer cells are high in glutathione, the cancer cells use this extra glutathione to protect themselves from the chemo or radiotherapy. In fact, this has been used to explain the resistance to treatment in certain cases. This has led to a lot of research where cancer cells, you can grow them outside of the body in what we call a cell culture. And experiments are done on these cancer cells themselves. Now, what has raised a lot of attention is that if you could deplete or lower glutathione levels in these cancer cells grown in a culture, you can make them more susceptible to damage by chemotherapy.
So again, this seems to argue in favor of lowering glutathione in patients, like not raising glutathione. So why aren't we just lowering the glutathione levels in cancer patients?
Well, the reason is following: when you do that, and this has been done in many clinical trials, and this is why we must make any major decisions on treatment methods based on human trials. I say this again and again: laboratory studies and animal studies, of course, they're important to our understanding, but when you take these experiments into a human study, so often we end up being surprised because of the outcome in the real world. So this is important, Doug. When you lower glutathione levels in patients before chemotherapy or radiotherapy, you find that the side effects of the treatment are so severe that the approach becomes impractical and even, unfortunately, can result in death of some of these patients. You know, they receive a drug to lower glutathione before they get their chemotherapy. They get their chemotherapy, and their immune systems are completely wiped out. And the next person that walks into the room and sneezes or coughs kills the patients. So this is not doable. And scientists are still trying to find a way to do this, so far with very little success.
So, okay, so that begs the question, raising glutathione levels in oncology. Is this a good idea or is it a bad idea?
Well, I have to think that most well-read people would not argue much with raising glutathione in patients who are not undergoing. So if you're not going to be getting chemotherapy or radiotherapy, this is not an issue. Now, again, so you always listen to your doctor before you listen to something you heard online. Of course, this is the safe thing to do.
But what about raising glutathione levels for patients who are receiving chemo or radiotherapy?
All right, so this is a complicated question that deserves a closer look. And this is what I've been proposing to doctors and scientists for decades now. I have to tell you, this has been a long and difficult argument with the medical community. You need to start by looking at all the available literature and trying hard not to cherry pick the articles that only support your point of view. So I welcome you all to do this yourself, and especially the doctors out there. Always do your own homework. You'll find that the vast majority of the successful studies looking at lowering glutathione before chemotherapy have been in tissue cultures or test tube studies and not in live human beings. I say the vast majority. Actually, I've never found any that have been useful enough to consider using as a clinical investigation. So if anybody finds one, please send it to me. But to my knowledge, I have not seen a study where lowering glutathione before chemotherapy in a human study works. I have not seen any. So again, alert me to it if you have. And just as importantly, I've not found a single article where raising glutathione in human cancer patients backfired. None. So again, if you come across one, again, I need to know, so send it to me. So I'm asking you all, if you do your homework and you find something that shows that I'm wrong, I need to know. And to make my life easier, because I was spending so much time answering this question again and again and again, I wrote this article. And it essentially summarizes what we just spoke about, but in much more detail and with dozens of references. So please feel free to read this if you want a deeper understanding. We'll make it available to you.
So you are suggesting that raising glutathione levels in humans can improve the outcome of chemotherapy and radiotherapy. So why is that?
All right. Unfortunately, we have to just look at a little bit of biochemistry. Let's just, I'll have this chart up there that you guys can download a copy of this lecture later on and study it if you're keen enough. But let me just focus in on one spot in this diagram. We see here that the amount of glutathione that could be made by a cell has a certain limit, because if you reach a certain ceiling of glutathione concentration, it will lead to down regulation of the glutathione, or it slows down the production of glutathione. You have enough glutathione, your cell is told that it has enough glutathione, and it shuts down production. So in this manner, a cell will make a pre-programmed amount of glutathione and no more. Now, because cancer cells already have a super high level of glutathione, it takes only a little bit of precursors to shut down production through negative feedback inhibition. Now, the first step was to show this in cell cultures, which Immunotech scientists have done in much earlier studies. And again, I won't bore you with the details. Here's some references to look up if you want to get deeper into this. Essentially, you see where levels drop at the end of these curves when glutathione precursors get too high in the tumor cells.
Selective modulation, it seems to be, to many, including myself, to be a complicated term. Can you just simplify that for us, Dr. Gutman?
Yes, for sure. I'm a little more visual, so let's look at a visual model here. So here we see a bunch of glutathione precursors. Note that I have labeled some of them CY for cysteine, which is the limiting amino acid, more specifically bonded or bioavailable cysteine. Okay, so you've got your precursors, including your cysteine. And when these precursors are taken up by normal healthy cells, they're used effectively to raise glutathione levels. But when they get to a cancer cell, which already has super high levels of glutathione, they cause the negative feedback mechanism to kick in, as we just saw. In simpler terms, the healthy cells start to produce glutathione, but the cancer cells is induced to make less glutathione. So effectively what happens, as you see, is a selective modulation of glutathione levels, so that the glutathione levels climb in healthy cells, but drop in cancer cells. And ultimately, the result is that the healthy cells become more resistant to the damaging effects of the chemotherapy, but the cancer cells have less resistance, so they can be damaged or die off quicker. Selective modulation. I hope that's a little bit clearer now.
It actually is. So, Dr. Gutman, you always tell people to ask for others to show them the research to prove what they say. So clearly, I'm going to ask you to show us the research. Has this been done?
And again, thank you for asking. You're asking what most people want to know. And we did this study specifically to answer that question. So let's take a look at this study here. You may recognize some of the authors here, Dr. Bunos, Dr. Droge, and more. But let's just focus on the title. Cysteine-rich protein, in this case, we're talking about Immunocal, reverses, please take note of this word, reverses weight loss in patients receiving chemotherapy and radiotherapy. Now, this, unless you're reading the cancer literature, this was the first study that ever showed a nutritional intervention. I'm not talking about drugs like anabolic steroids, that actually reversed the muscle loss seen in end-stage cancer patients. Good nutrition can slow down the process, but we reversed it. And this clinical study meets all of the criteria for what we call a gold standard study. It randomized, double-blind, placebo-controlled, and took place in multiple excellent cancer stations across Canada. You could see some of the names there: McGill, University of Alberta, McMaster, and so on. Initially, we wanted to look at both lung cancer and colon cancer, but we didn't recruit enough bowel cancer patients, so we focused only on lung cancer. And it's important to note that in our inclusion criteria, the patients that we picked, these patients had to already have shown signs of muscle loss. In other words, they were in their late stage cancer by definition. Some of the measurements were easy. They were objective measurements: body weight, cell mass, hand strength. These are firm numbers. Of course, we also wanted to look at quality of life measurements, which really counts more from the patient's perspective. These are a bit more subjective measurements. So we use a number of different measurement profiles, and you could see them here. And here you go, a clear and significant increase in body weight and in muscle mass. Again, the first time ever. And here you see that the patients themselves reported significant improvements in their quality of living. This alone is critical. And finally, the burning question: did these patients live longer? Let me just point out this group of numbers. A year after the study was completed, we went back to see who could report on their condition. About 80% of the patients treated with Immunical were alive. Less than 50% of the patients who didn't get Immunical, well, they had passed away. These are very, very encouraging numbers, and I'm calling out for more studies to further validate this. So let's summarize. Cancer cells are often found to be high in glutathione. This high glutathione can cause resistance to chemotherapy, yes, but when you grow these cancer cells outside of the body, then lower glutathione levels, this makes them more susceptible to being damaged or killed by chemo and radiotherapy. However, when you do this in a living organism, like a human, this may lead to extremely high levels of adverse effects and even death. So this, so far, has not turned out to be an effective strategy. And here's where our own scientists have added so significantly to the research. Through the use of precursors, glutathione levels can be selectively modulated with really, really promising results. So thank you all for your attention. And Doug, thank you for your difficult questions. I'm just going to jump on the slide for a moment to tell people that if they want more information about glutathione, including a whole chapter on glutathione and cancer, feel free to get this book over here. And you could find it on Amazon, and you could find it on Amazon Kindle, or you could visit my Facebook page, where I'm always posting new articles on glutathione research. And we will end up posting this lecture in a couple of weeks on my YouTube channel, Dr. Jimmy Gutman. So thank you.